You'll never guess, on the way here, I spoke to a woman. She had never heard of an estrogen cream.
Wow.
Never. And she'd be late 60s, early 70s, and never used an estrogen cream. Sometimes she buys something over the counter, but that's really just for sex and not for anything else.
Right.
So let's talk about and the importance of it, and how do we get the message out there to women?
Yeah. So that lady was probably using a lubricant, which of course is not going to help your vaginal health. It just helps with actually having intercourse and makes it a little bit more comfortable. And what happens when we go through menopause is that we start to produce less estrogen, less progesterone from our ovaries. And it's not just our bones and that miss this, the skin around the vagina misses it as well. It gets thinner, it loses some of its fatty tissue, and that's actually not a good thing. It may be a good thing to lose fatty tissue in other areas, but not around the vagina. And that means that you can get symptoms related to the skin of the vagina, or you can get symptoms related to the organs in the pelvis not being as well supported. You've got the vagina, you've got the uterus and the cervix, you've got the bladder and the bladder opening, and you've got the rectum as well. And if they're not supported, then you're going to start getting prolapse of those organs. Using that topical cream that you're talking about, the estrogen cream, if you put that into the vagina twice a week, that kind of feeds the skin. And if it feeds the skin, it stays plump and it keeps everything up where it belongs, and it stops you from getting those irritated symptoms that she was probably getting of an itchy fanny, irritated, burning even, and pain on intercourse.
Yeah. Well, you know, with sex lives going a lot later, a lot older these days,
exactly,
then we have to do everything to make it comfortable for women. And if that's a side effect of some good treatment, then I'm all for it.
Yeah, definitely. Well, one of the other really lovely spin-offs is that once you do go through menopause, when you've got this thinning of that area, you can get recurrent urinary tract infections.
Yes.
And that's a really common problem that I hear about. And if you use that topical estrogen cream, or you can get it in a pessary form if you don't like the cream. So a pessary is like a tablet that you put into the vagina. It dissolves and it feeds the skin in that area, and there's very, very little that's absorbed into the whole system. So we're not talking hormone replacement here, we're just talking giving a little bit of hormone to an area of the body that's missing it. You'll get less urinary tract infections if that bladder is really well supported.
Yeah. Well, I'm all for topical applications as against internal applications, so I think it's great stuff. But how do you suggest we get this message out to women? How do we actually make sure that at their postmenopausal check, which again this woman
most
never
people don't have,
how do we make sure that that is one thing that even our male doctors are actually telling our female patients?
Yeah, I think first of all, you've got to be not afraid of saying to your doctor, you know what, I've actually got a problem with my fanny.
Okay, number one, don't be afraid to tell your doctor.
No, exactly. So say it's irritated, it's burning, it's sore, I don't like having intercourse, I'm avoiding it because it's uncomfortable. So start that conversation. It's not that difficult once you actually get going.
Yeah.